Next question, do you ask a pediatrician or an OBGYN? The question is, my tween-age daughter has sex questions. Is it better for her to ask the pediatrician or start seeing an OBGYN?
I would prefer, and I don't know what you would say, but I would prefer that you go ahead and bring your tween in to see me if she's already asking about sex. I want to give her the low down and dirty about not having sex too early.
So the lowdown and not getting dirty.
Exactly.
Right,
Yes.
Exactly.
Yeah,
Yes.
exactly. You know, some pediatricians actually specialize in adolescent medicine, especially if it's a female pediatrician. You know, the child, if they're even younger than 13, 12, somewhere in there, might already feel pretty comfortable with a pediatrician. So certainly, if that pediatrician is comfortable with that subject,
Right.
you know, that's a great way to go.
Well, and it also, I think what it really comes down to also is a comfort level.
Yes.
Right.
Yeah.
And it may matter if you have a male pediatrician and it's a young woman, she may feel more comfortable.
Yeah, especially if their
I
office is
try to
filled
relate
with.
to my patients as though she were my girlfriend.
Right.
Or like a sister or a cousin. And if I can relate to the patient in that manner, I'm going to get through.
What age, this is for both OBGYNs and pediatricians, what age do you recommend parents potentially bring in their child for that conversation?
Certainly, I think by age 13
At
usually
least.
is, you know,
I think,
younger.
I
if-
think
Sure.
the level of maturity will determine that, because if you've got an 11-year-old talking to you about sex questions, it may be time.
Well, and
Yes.
girls and boys are going through puberty earlier. We
Earlier.
talked on the show
Right.
recently where in the last 30 years, boys are going through puberty 18 months earlier than they used to, which means pregnancy can become an issue
It
at
does.
ages 10 and
My
11.
youngest
So
OB patient was 10.
that's young.
That's
I didn't
young,
have one
right.
that young. My
I-
youngest was 13.
I've had one 10.
pretty young to be
I
having
tell
a
you.
baby.
I actually find talking to the patient with the mother initially, and then without the mother works best.
Oh, sure.
Makes
Yeah.
her more
Especially
comfortable.
if she has an adult problem,
That's
you're gonna
right.
treat her like an
The
adult.
key is having the conversation in the first place. One of the things I really want people to know is that, hey, if you're not sure who you should be asking, which specialist, your pediatrician, your OBGYN, just ask. If they're not comfortable having that conversation, they should tell you who the proper specialist is to discuss that issue with.